Mihira, how's the patient in room 312 doing?
Well, Dr. Paul, the patient is stable but presenting some complexities. Their blood pressure is fluctuating, and their heart rate is slightly elevated. We've administered the prescribed medication, but the symptoms persist. Additionally, they're experiencing some discomfort in their lower abdomen, which they attribute to recent dietary changes. We've adjusted their diet, but the discomfort hasn't subsided entirely.
All right, let's break this down. The fluctuating blood pressure and elevated heart rate could be a side effect of the medication or an underlying condition. We'll need to monitor their vital signs closely and consider adjusting the medication dosage. Regarding the abdominal discomfort, while dietary changes can sometimes trigger such symptoms, we should also rule out any potential infection or inflammation. A thorough physical examination and perhaps some diagnostic tests will be necessary.
I've already scheduled a follow-up with the gastroenterologist to discuss the abdominal discomfort in more detail. We'll keep a close eye on their vital signs and adjust their treatment plan as needed.
Good, that's a solid plan, Mihira. Keep me updated on their progress, and don't hesitate to reach out if you have any concerns. Mihira, I can see how worrying it must be to see your child struggling to breathe, and I want to reassure you that you're not alone in this. Asthma is a very common condition, and the most important thing to know is that it can be managed incredibly well. With the right care and a good plan, we can help prevent future episodes and ensure your child can live a full, active life without being held back by their symptoms. The key is to understand what triggers these episodes and to have the right strategies in place to manage them. To get started on that, there are some important next steps. First, we need to arrange an appointment with your GP. This visit is crucial because the doctor will be able to make a formal diagnosis and create a personalized action plan for your child. They may also arrange for some necessary tests, such as a simple breathing test, to get a better understanding of how their lungs are working. Following the diagnosis, the doctor will be able to provide the appropriate medication. This usually includes a reliever inhaler for when symptoms flare up and possibly a preventer inhaler to be used daily to reduce inflammation and stop symptoms from starting in the first place. We'll make sure you know exactly how and when to use these so you can feel confident and prepared.